of WeChat, and Miss Na Li, the accomplished tennis player who rose to number 2 in the world of women's tennis. Throughout its extraordinary 70 years, HUST has actively integrated itself into China's economic development, becoming a vital mainstay of the Yangtze River economic belt. The university continues to establish joint research centers and industrial bases in partnership with local governments and industries across China, and promotes technological transfer to business enterprises, as well as the commercialization of research outcomes flowing from the university's laboratories. The Tongji Medical College, founded by a German doctor, Erich Pollun, in 1907, enjoys its reputation as one of the best med schools in China. It's here that Professor Qiu Fezu, the founding father of modern Chinese surgery, saved countless people's lives with his pioneering approach to surgery, including organ transplant procedures. The university maintains 11 well-established affiliated hospitals, which integrate the functions of medical treatment, teaching, and research, serving as major medical diagnosis and treatment centers for central China. Today, through various university partnership programs, HUST has effectively established an extensive and diversified global partnership network, and it remains committed to building platforms for cultural exchange, as well as joint research to tackle major scientific challenges faced by humanity. Currently, nearly 3,600 international students from all over the world are studying at HUST for exchange and degree study. High-quality international education and diversified overseas study programs complement each other, together creating a bridge for students to explore the world. Every year, over 4,000 HUST students travel overseas to pursue internships, exchanges, or degree study. Today, Watchong University of Science and Technology declares its own aspiration to provide the best quality education to promising young talents, to serve nation as well as to contribute to global development, and ultimately, to create a more brilliant and splendid future for all humankind to flourish.
大家好，我是郭庆林，是中文路公司的董事长兼创始人。近些年来，越来越多的学生选择到中国留学。在我接触的留学生当中，他们大多数是非常优秀，汉语也说得非常好。那么中文路会给学生带来什么好处呢？首先，中文路教学平台是我们技术团队自主研发，而不是使用第三方提供的平台。这就保证我们能够比较少出现技术问题。其次，在中文路上课的老师都是我们经过重重考核筛选出来的优秀教师，他们都毕业于中国知名大学的汉语国际教育或者相关的专业，并且至少2年以上的海外教学经验，有些优秀老师甚至还有8到10年实战经验。再次，我们有专业贴心的高级学习顾问团队，他们亲切可人，亦师亦友，会根据学生们的水平和需求推荐不同的课程，让同学们可以更快、更高效地掌握中文这门语言。除了线上中文学习以外，中文路还为广大的学生提供专业的来华留学咨询服务。我们与中国50多所知名高校有合作，并熟悉中国各高校的排名和招生的情况，能根据大家的需求推荐合适的高校。中文路也希望给同学们带来更多更好的留学中国的机会。
我叫阮世林，我的 HSK 5级成绩就是282分，这是我想不到的成绩。在中文路学习的3个月，我觉得中文路的老师 帮忙了我很多。然后在学习的过程中，我可以知道我的错误、不足的地方，然后尽力去改，让自己的中文水平变得更好。我认为学习中文最好的方法就是多跟中国朋友交流，多跟中国老师学习，就这样了。
大家好，我叫深深。去年我通过中文路成功申请了南京大学的奖学金，我在中国等你们。Hello， 大家好，我叫阮世林，今年19岁，是西北大学汉语言专业的学生。很感谢中文路公司在我申请奖学金的过程中对我有很多的帮忙，祝公司越来越发展，也希望公司可以帮助更多的学生实现自己留学之梦，也希望大家可以申请我们西北大学的奖学金，我在西北大学等你哦。
你们好，我叫吴旧相，我是通过中文路申请到了中南大学的奖学金，我现在是线上上学，预计明年9月去中国留学，我在中国等你们哦。
Watchong University of Science and Technology, an academic palace where the twin inspirations of science and humanity merge in its nearly 70 years history, has encouraged countless HUST students to forge ahead from the campus Yujia Mountain to the larger world. Founded in 1952, HUST, now a key comprehensive university in China, is one of the first universities approved under the National Double First Class Initiative, China's Excellence Initiative for Higher Education Institutions. The university is located in the city of Wuhan, a megacity with rich history and picturesque landscape. Also a major traffic hub and high-tech powerhouse in central China. Established as a vibrant and diverse community, HUST infuses the passions and pursuits of nearly 60,000 students and faculty from across the country and around the world, pushing them to grow and prosper in this university in the forest. The university boasts a full range of academic disciplines, comprising 10 major categories that range from its traditional strengths of engineering, medicine, and its fast-growing science departments, to distinctive social science and humanities, such as journalism and philosophy. In recent years, HUST has enhanced its focus on the development of 11 discipline clusters, with an aim to ultimately establish an organic, multidisciplinary ecosystem to spur the frontier exploration of knowledge and innovation. It is an institution marked by original innovation and major scientific breakthroughs. Consider just these 4 national laboratories and research institutes. These are like 4 shining pearls atop the university's beacon. HUST is committed to creating a favorable environment for students to learn independently and happily, cultivating a spirit of pioneering innovation. This favorable atmosphere of innovative entrepreneurship makes it possible for such a large number of our students and scholars to stand out in all walks of life. A few of many examples include Professor Pei Gongzheng, the originator of development economics, Professor Mengqiao Wu, the pioneer of Chinese hepatobiliary surgery, Mr. Alan Zheng, the developer of WeChat, and Miss Na Li, the accomplished tennis player who rose to number 2 in the world of women's tennis. Throughout its extraordinary 70 years, HUST has actively integrated itself into China's economic development, becoming a vital mainstay of the Yangtze River economic belt. The university continues to establish joint research centers and industrial bases in partnership with local governments and industries across China, and promotes technological transfer to business enterprises, as well as the commercialization of research outcomes flowing from the university's laboratories. The Tongji Medical College, founded by a German doctor, Erich Pollun, in 1907, enjoys its reputation as one of the best med schools in China. It's here that Professor Qiu Fezu, the founding father of modern Chinese surgery, saved countless people's lives with his pioneering approach to surgery, including organ transplant procedures. The university maintains 11 well-established affiliated hospitals, which integrate the functions of medical treatment, teaching, and research, serving as major medical diagnosis and treatment centers for central China. Today, through various university partnership programs, HUST has effectively established an extensive and diversified global partnership network, and it remains committed to building platforms for cultural exchange, as well as joint research to tackle major scientific challenges faced by humanity. Currently, nearly 3,600 international students from all over the world are studying at HUST for exchange and degree study. High-quality international education and diversified overseas study programs complement each other, together creating a bridge for students to explore the world. Every year, over 4,000 HUST students travel overseas to pursue internships, exchanges, or degree study. Today, Watchong University of Science and Technology declares its own aspiration to provide the best quality education to promising young talents, to serve nation as well as to contribute to global development, and ultimately, to create a more brilliant and splendid future for all humankind to flourish. Watchong University of Science and Technology, an academic palace where the twin inspirations of science and humanity merge in its nearly 70 years history, has encouraged countless HUST students to forge ahead from the campus Yujia Mountain to the larger world. Founded in 1952, HUST, now a key comprehensive university in China, is one of the first universities approved under the National Double First Class Initiative, China's Excellence Initiative for Higher Education Institutions. The university is located in the city of Wuhan, a megacity with rich history and picturesque landscape. Also a major traffic hub and high-tech powerhouse in central China. Established as a vibrant and diverse community, HUST infuses the passions and pursuits of nearly 60,000 students and faculty from across the country and around the world, pushing them to grow and prosper in this university in the forest. The university boasts a full range of academic disciplines, comprising 10 major categories that range from its traditional strengths of engineering, medicine, and its fast-growing science departments, to distinctive social science and humanities, such as journalism and philosophy. In recent years, HUST has enhanced its focus on the development of 11 discipline clusters, with an aim to ultimately establish an organic, multidisciplinary ecosystem to spur the frontier exploration of knowledge and innovation. It is an institution marked by original innovation and major scientific breakthroughs. Consider just these 4 national laboratories and research institutes. These are like 4 shining pearls atop the university's beacon. HUST is committed to creating a favorable environment for students to learn independently and happily. Cultivating a spirit of pioneering innovation. This favorable atmosphere of innovative entrepreneurship makes it possible for such a large number of our students and scholars to stand out in all walks of life. A few of many examples include Professor Pei Gongzheng, the originator of development economics, Professor Mengqiao Wu, the pioneer of Chinese hepatobiliary surgery, Mr. Alan Zheng, the developer of WeChat, and Miss Na Li, the accomplished tennis player who rose to number 2 in the world of women's tennis. Throughout its extraordinary 70 years, HUST has actively integrated itself into China's economic development, becoming a vital mainstay of the Yangtze River economic belt. The university continues to establish joint research centers and industrial bases in partnership with local governments and industries across China, and promotes technological transfer to business enterprises, as well as the commercialization of research outcomes flowing from the university's laboratories. The Tongji Medical College, founded by a German doctor, Erich Pollun, in 1907, enjoys its reputation as one of the best med schools in China. It's here that Professor Qiu Fezu, the founding father of modern Chinese surgery, saved countless people's lives with his pioneering approach to surgery, including organ transplant procedures. The university maintains 11 well-established affiliated hospitals, which integrate the functions of medical treatment, teaching, and research, serving as major medical diagnosis and treatment centers for central China. Today, through various university partnership programs, HUST has effectively established an extensive and diversified global partnership network, and it remains committed to building platforms for cultural exchange, as well as joint research to tackle major scientific challenges faced by humanity. Currently, nearly 3,600 international students from all over the world are studying at HUST for exchange and degree study. High-quality international education and diversified overseas study programs complement each other, together creating a bridge for students to explore the world. Every year, over 4,000 HUST students travel overseas to pursue internships, exchanges, or degree study. Today, Watchong University of Science and Technology declares its own aspiration to provide the best quality education to promising young talents, to serve nation as well as to contribute to global development, and ultimately, to create a more brilliant and splendid future for all humankind to flourish. Watchong University of Science and Technology, an academic palace where the twin inspirations of science and humanity merge in its nearly 70 years history, has encouraged countless HUST students to forge ahead from the campus Yujia Mountain to the larger world. Founded in 1952, HUST, now a key comprehensive university in China, is one of the first universities approved under the National Double First Class Initiative, China's excellence initiative for higher education institutions. The university is located in the city of Wuhan, a megacity with rich history and picturesque landscape. Also a major traffic hub and high-tech powerhouse in central China. Established as a vibrant and diverse community, HUST infuses the passions and pursuits of nearly 60,000 students and faculty from across the country and around the world, pushing them to grow and prosper in this university in the forest. The university boasts a full range of academic disciplines, comprising 10 major categories that range from its traditional strengths of engineering, medicine, and its fast-growing science departments, to distinctive social science and humanities, such as journalism and philosophy. In recent years, HUST has enhanced its focus on the development of 11 discipline clusters with an aim to ultimately establish an organic, multidisciplinary ecosystem to spur the frontier exploration of knowledge and innovation. It is an institution marked by original innovation and major scientific breakthroughs. Consider just these 4 national laboratories and research institutes. These are like 4 shining pearls atop the university's beacon. HUST is committed to creating a favorable environment for students to learn independently and happily, cultivating a spirit of pioneering innovation. This favorable atmosphere of innovative entrepreneurship makes it possible for such a large number of our students and scholars to stand out in all walks of life. A few of many examples include Professor Pei Gongzheng, the originator of development economics, Professor Mengqiao Wu, the pioneer of Chinese hepatobiliary surgery, Mr. Alan Zheng, the developer of WeChat, and Miss Na Li, the accomplished tennis player who rose to number 2 in the world of women's tennis. Throughout its extraordinary 70 years, HUST has actively integrated itself into China's economic development, becoming a vital mainstay of the Yangtze River economic belt. The university continues to establish joint research centers and industrial bases in partnership with local governments and industries across China, and promotes technological transfer to business enterprises, as well as the commercialization of research outcomes flowing from the university's laboratories. The Tongji Medical College, founded by a German doctor, Erich Pollun, in 1907, enjoys its reputation as one of the best med schools in China. It's here that Professor Qiu Fezu, the founding father of modern Chinese surgery, saved countless people's lives with his pioneering approach to surgery, including organ transplant procedures. The university maintains 11 well-established affiliated hospitals, which integrate the functions of medical treatment, teaching, and research, serving as major medical diagnosis and treatment centers for central China. Today, through various university partnership programs, HUST has effectively established an extensive and diversified global partnership network, and it remains committed to building platforms for cultural exchange, as well as joint research to tackle major scientific challenges faced by humanity. Currently, nearly 3,600 international students from all over the world are studying at international education and diversified overseas to pursue internships, exchanges, or degree study. Today, Watchong University of Science and Technology declares its own aspiration to provide the best quality education to promising young talents, to serve nations as well as to contribute to global development, and ultimately, to create a more brilliant and splendid future for all humankind to flourish. Watchong University of Science and Technology. And
大家好，我是郭庆林，是中文路公司的董事长兼创始人。近些年来，越来越多的学生选择到中国留学， 在我接触的留学生当中，他们大多数是非常优秀，汉语也说得非常好。那么中文路会给学生带来什么好处呢？首先，中文路教学平台是我们技术团队自主研发，而不是使用第三方提供的平台，这就保证我们能够比较少出现技术问题。其次，在中文路上课的老师都是我们经过重重考核筛选出来的优秀教师，他们都毕业于中国知名大学的汉语国际教育或者相关的专业，并且至少2年以上的海外教学经验，有些优秀老师甚至还有8到10年的实战经验。再次，我们有专业贴心的高级学习顾问团队，他们亲切可人，亦师亦友，会根据学生们的水平和需求推荐不同的课程，让同学们可以更快、更高效地掌握中文这门语言。除了线上中文学习以外，中文路还会广大的学生提供专业的来华留学咨询服务。我们与中国50多所知名高校有合作，并熟悉中国各高校的排名和招生的情况，能根据大家的需求推荐合适的高校。中文路也希望给同学们带来更多更好的留学中国的机会。
我叫阮世玲，我的 HSK 5级成绩就是282分，这是我想不到的成绩。在中文路学习的3个月，我觉得中文路的老师帮忙了我很多。然后在学习的过程中，我可以知道我的错误、不足的地方，然后尽力去改，让自己的中文水平变得更好。我认为学习中文最好的方法就是多跟中国朋友交流，多跟中国老师学习，就这样了。
大家好，我叫珊珊。去年我通过中文路成功申请了南京大学的奖学金，我在中国等你们。Hello， 大家好，我叫阮世玲，今年19岁，是西北大学汉语言专业的学生。很感谢中文路公司在我申请奖学金的过程中对我有很多的帮助，祝公司越来越发展，也希望公司可以帮助更多的学生实现自己留学之梦，也希望大家可以申请我们西北大学的奖学金，我在西北大学等你哦。
你们好，我叫吴旧相，我是通过中文路申请到了中南大学的奖学金，我现在是线上上学，预计明年9月去中国留学，我在中国等你们哦。
大家好，我是郭庆林，是中文路公司的董事长兼创始人。
Okay, good evening, ladies and gentlemen. Welcome to Chinese World Study in China Education Carnival. Because of the unprecedented pandemic, we are separated physically. However, for the same reason, we are all brought up online. Because of the recurrent COVID-19, a lot of international students can study in China, but it's a good side too. We are also very used to studying Chinese language online. Okay, so Chinese Road is an education and technology company providing both online Chinese language courses and also study in China consulting services. We have a great team of professional teachers who are all major in either teaching Chinese as a second language or other Chinese language related majors. Besides, on our platform, there are plenty of Chinese courses for your choices. No matter what you do or where you are, you will find the right course to study on Chinese Road. So, okay, this is what we're gonna do tonight. I'm gonna give you a briefing of the night. First, we will have a brief introduction to our guests. Next, our professionals from university will have a speech, which is about like 30 minutes long. Then we will explain in details about the admissions policy of Watchong University of Science and Technology. And then we will have a 10-minute Q&A. After all this, we will have the one and only lucky draw, which I know a lot of you have been waiting for. At the end of the night, we will have a group selfie. So all of you, please be ready to turn on your camera and remember to smile when we take the selfie. Okay, so today we are very honored. We are very honored to have three professionals from Tongji Medical College of Huazhong University of Science and Technology. Please welcome Dr. Li Boyang. And please welcome Dr. Wu Hong. And finally, Dr. Wang Ruoxi. Besides, we also have Mr. Yu Wenchang from Admission Office. Huazhong University of Science and Technology is a comprehensive research university located in Wuhan, China, under the direct supervision of the Ministry of Education. It is one of the first universities approved under the National Double First Class Initiative, China's Excellence Initiative for Institutions of Higher Education. Not only they will demonstrate the importance of health management during COVID-19, but also they will explain in details about the study in China policy under the influence of the pandemic. Okay, now we know a lot about HUST. Before we start, wow, everyone, please take out your phone and scan the QR code on the screen. As you can see right now, there are 3 screens separated. They are in Indonesian, Vietnamese, and English. So just scan the corresponding QR code as you need. And then you will see a form pop out requiring you to fill out your name, your cell phone number, your email address for our lucky draw. You won the lucky draw, right? So you better fill out the form. Our staff members will give out the link address in the chat box for you to fill out. So please hurry up and start filling now. Okay, we will have about like 2 minutes for you to fill out the form first before we get into anything. You will want to fill out the form, and it's the only way to get participated in the lucky draw. As you can see right now in the chat box, yeah, we have our staff members giving out the link address in both Indonesian and Vietnamese. There's the link, so click into it, and then you can like fill out all the information. Do you see it? The form, the link address. Okay, we will give you like 1 more minute to fill out the form. Okay, have you now finished on the form? If you don't, take some more time, and we are about to begin our journey tonight. Okay, time's up. It's not time's up, but if you need more time, you can continue filling out the form, but we're gonna carry on. Okay, now let's begin. Please welcome our 3 professionals from Huazhong University of Science and Technology. Sorry.
Hi, everyone. Could you hear me?
Yes.
Okay, so great. So could you see the PowerPoints I'm I'm playing?
Not right now.
Okay, so I will do it again. Sorry. So So could you see it now? If you can see it, please give me a sign.
Yes, now we can see it.
Okay, so, all right. So everyone, I think it's my turn to do the first presentation. And I'm the first one. And in China, we have a saying that is 抛砖引玉. The meaning is I throw out a brick and could seduce or induce some jade. So I hope that my bricks could induce more jade from my colleagues. So I'd like to introduce myself again. My name is Boyang Li, and you can call me Boyang or Dr. Li, whatever you want. So I'm from the School of Medicine and Health Management of Chongqing Medical College of Watchong University of Science and Technology. And my topic today is the COVID-19 and China's responses, action, mobilization, and innovation. And as of today, I think you may all know, but based on the dashboard from WHO, the COVID-19 has now affected more than 100 countries and over 93 million people. Okay, the number is really devastating. And we could say that the pandemic is one of the biggest threats to human being in history in terms of health, economic, and social development. This rapid spread of COVID-19, the wide range of the infections, and the difficulty in prevention and control are also unprecedented in the history of China. Under the strong leadership of the government, the Chinese people united as one to fight against this disease. As a result of all the hard work, the surge curve has been flattened very soon, and the society is now back to the normal, or we could say the new normal, because there are still some small outbreaks from time to time, and the society are still being very vigilant. As China and WHO joint mission pointed out, in face of this unknown virus, China has taken the courageous, flexible, and aggressive control measures. So within just 7 weeks, hundreds of thousands of cases have been averted by building up the strong first line of defense. So the question is, what are the key approaches has China done to respond to this deadly virus? How China control it? In its response efforts, China has been taken into consideration of its social and economic systems and structure, public health capacity, public health resources and emergency response capacity, and following the classic principles in infectious disease prevention and control in a creative way to control the source of infection, interrupt the transmission, and protect the susceptible population. These classic principles are practiced effectively in China in its globalization process, indicating that they are not lost in the light of time, but still shining in the 21st century. So I would like to summarize China's experiences into 4 major points. Firstly, the proactive prevention and control model is used by emphasizing the importance of the frontline. The principles of early detection, early reporting, early isolation, and early treatment were practiced. The prevention and control protocols were revised and updated for 6 times at the early times of the outbreak, ensured every step and detail of prevention and control efforts was clarified, precise, and doable, ensured all populations, all site settings, and all communities were covered by the control efforts without gaps with focus on early detection. The healthcare facilities were required to report online any detected cases within 2 hours. The laboratories were required to provide a testing result within 12 hours. The CDCs in different provinces or the cities were required to complete epi investigation within 24 hours and trace close contacts. 15 technical protocols were issued with specific and targeted measures for the elderly, children, and other key populations, as well as public places such as train stations and malls, and key settings such as businesses and schools. Of course, also in early times of the outbreak. And clarified accountabilities to ensure orderly resumption of work. And secondly, coordinate and deploy health resources. Designated hospitals in Wuhan were rapidly adjusted and expanded to accommodate the surge of patients, with beds increased during a short period of time from 5,000 to 23,000, including over 9,000 beds in ICU. A number of gyms, exhibition center, and training centers were modified into mobile cabin hospitals and isolation centers. The first 3 mobile cabin hospitals built up in 29 hours have 4,000 beds. Accumulatively, over 12,000 mild patients were admitted to 6 mobile cabin hospitals. The national labs, local labs, and third-party labs were mobilized with 3 BSL-3 level labs deployed that helped increase the daily capacity of PCR testing to 35,000 per day. So you can see that on these slides that the gyms and the exhibition centers were used as these mobile cabin hospitals at the early times. And above mentioned measures expanded medical resources rapidly to ensure severe cases treated in the designated hospitals, mild cases treated in the mobile cabin hospitals, and suspected febrile patients and close contacts isolated in isolation sites to avoid community transmission. And thirdly, close collaboration is carried out to improve treatment. More than 40,000 outstanding medical personnel across the country in over 340 medical teams and national emergency medical teams were deployed to Wuhan at a very soon time. Of them, 15,000 were professionals in critical care, infectious disease care, respiratory medicine, and circulatory medicine, and also the anesthesiology. We insisted on 4 concentrations, which is the concentration of patients, concentration of experts, concentration of resources, and concentrated treatment with focuses on improving admission rate, cure rate, and reducing infection rate and case fatality rate. The experts of multiple disciplines developed the clinical protocol for COVID-19 and have revised it for 7 times. In practice, the clinical practice and pathology findings, frontline and rear supplies, doctors and nurses, management and clinical practice have been closely linked. The mechanisms were established, including reporting critical cases within 24 hours, death rate discussion, severe case inspection, etc. And fourth, the high technology is widely used as a key to fight against COVID-19 in China. And we integrated scientific research with prevention and control efforts, used big data and information technology to help implementation of people mobility restriction and traffic control, as well as help with epi investigation. Multiple research institutions were coordinated to have the pathogen identified within 8 days and shared with the international community in whole genome sequence of some of the viral strains. The test kits were optimized within 16 days. Key research projects were launched urgently, and clinical trials were conducted with multiple lines of drug development going on. And also the traditional Chinese medicine were widely used in prevention, treatment, and rehab services. So that is basically my presentation for the China responses for the COVID-19. And of course, the war is still going on. I think not only in China, but also in the world. And as the saying goes, that we should unite it as one, and we should unite it as one to fight with the virus, so we can get out these virus together. So thank you very much, and that would be all. And thank you.
Okay, thank you, Dr. Lee. That was very detailed and very thoughtful. Thank you, Dr. Lee. All right. Please welcome the Dr. QR. Okay, please welcome Dr. Wu.
Yeah.
For our
can you hear
next
me, Michael?
presentation. Yes, we can hear you.
Oh, okay, thank you. Okay, thanks for giving me this opportunity to attend this activity and share Chinese experience in fighting against the COVID-19. I will share my PowerPoint.
Yes, you need to hit the share screen button. Yes, we got it. Yep.
Yeah, I'm Dr. Wu Hong from the School of Medicine and Health Management of Watchong University of Science and Technology. Today, I will share you with the innovative epidemic control and care solutions based on the big data, artificial intelligence, and other new digital technologies based on Chinese experience. As we know, the COVID-19 pandemic is the most extensive public health emergency to afflict humanity in a century. It poses a serious challenge to global healthcare systems. During the outbreak of the COVID-19 in China, the government took comprehensive and stringent preventive and control measures to bring the outbreak under control quickly. It's noteworthy that the digital technology has played a key role in our response to the COVID-19. As the medical information management workers, we are very concerned about the role of health digital technologies in the prevention and care of disease during the pandemic. My collaborators and I have published an article in the April of 2020. That study has developed a technical framework responding to the COVID-19 epidemic from a health informatics perspective, in order to provide theoretical and practical references for other countries on how can health information technology be used to respond to the COVID-19 pandemic, as well as to various public health emergencies and disasters. This is the framework. It includes service recipients, health information technology participants, technologies, application scenarios around 4 main stages of the COVID-19. From this framework, we are able to gain a clear understanding of how health digital technologies are being applied to the epidemic response, and how it functions at different stages of the epidemic. Based on the experience in China, the most effective methods to control infectious disease are isolation and care, and all activities to control the epidemic revolved around these two objectives, including detection, early response, intervention, and post-intervention. We can see that a variety of emerging technologies, such as the cloud computing, big data, Internet of Things, mobile internet, artificial intelligence, and the fifth generation mobile networks are being used for the epidemic prevention and control. These main application scenarios include information delivery, screening, risk assessment, tracking, intelligent diagnosis, and case detection and telemedicine. During the pandemic, the task of the epidemic prevention and control was facing enormous. challenges. For the care in the COVID-19, two groups of people need care during the pandemic. There are people with symptoms of the COVID-19, namely the confirmed patients. However, in the early stages of the epidemic, fewer clinics for outpatient and hospital beds were severely overloaded in some areas in China. There were insufficient medical services for people with these confirmed patients, and other people who also need medical services, such as these patients with chronic disease, such as diabetics. And the demand is very big. However, home quarantine keeps them from going to the hospital. Under this situation, the contradiction between care demand and care supply becomes more apparent. Against this backdrop, local governments, healthcare institutions, and a range of companies in China are taking full advantage of the mobile internet and the fifth generation technologies to actively provide internet healthcare services with clinical experts from all over the country. In addition, the government agencies encouraged the provision of the Internet Plus medical insurance services, which has significantly promoted public utilization of the Internet hospital. The Internet hospital and the drug distribution have played a prominent part in the medical service provision. Specifically, we can see the remote video consultations and the diagnostics are widely used to provide care for these confirmed patients in different areas and nations. For people with this chronic disease, home delivery services provided by the internet hospitals were also an important demand during the outbreak. Moreover, due to the rapid increase in the number of the confirmed cases and deaths during the epidemic, both medical staff and the public have been suffering from these psychological problems, including anxiety and depression. As a result, the internet hospitals started to offer several types of online mental health services. These digital technologies have been exhaustively applied to find every infected person and track every close contact for quarantine. These health quick response codes and digital travel records have been applied as permits for making trips, going to school or work, and assessing certain public venues, and for other daily errands. An epidemic map has been created based on big data to display the specific names and locations of the communities where cases have been reported and the number of infections that has been ascertained. This map has made it easier for the public to guard against the infection. Practice in China has demonstrated that emerging digital technologies have unique advantages and can play a pivotal role in addressing major public health challenges. Future clinical information systems, personal health records, and big data infrastructures should have capability for the rapid adaptation to these public health emergencies. Moreover, we have to consider the multiple effects of the information technology, such as the spread of the fake news and rumors, the ethical and privacy issues involved in the leverage of the artificial intelligence and big data technologies. Owing to the popularity of the internet and social media, we can see the information epidemics often occur along with the disease outbreaks. So it's also very important to make use of the information technology to increase the transparency of information on epidemics, to reduce the public panic and enhance public confidence in fighting against the epidemics. During the prevention and control periods, the digital side should prevent technology abuse, while the government and the platforms should always pay attention to promote technology for the good and the benefit of the public. As the information management worker, this is also an important topic for us to research in the future. More information can be found in our paper. You can also contact us via the corresponding author's mail. And that's all for me. Thanks for your attention.
Okay, thank you, Dr. Wu. Wow, that was very professional. I think your speech just added just double our value in terms of academic value of the event tonight. Okay, thank you, Dr. Wu. So next, please welcome Dr. Wang for the next presentation, for the next speech. Okay, now we got it. Dr. Wang, please unmute your microphone. Yep.
Can we hear me now? Sorry about that.
Yep,
okay.
Now we got it.
Okay. Good evening, ladies and gentlemen. I'm Roxy Wang from the School of Medicine and Health Management of Watchong University of Science and Technology. It's a privilege for me to join this webinar. In the next few minutes, I would like to introduce you with the contribution the school made in fighting against COVID-19. Sorry, I cannot control. Okay. In general, the contribution the school made in COVID-19 responses and global health administration mainly covers two aspects. On the one hand, the staff of the school devoted themselves in COVID-19 responses by sharing their professional knowledge. On the other hand, the school has trained a lot of qualified talents for the community. Underpinned by the knowledge learned from the school, they greatly contribute to the COVID-19 responses at different positions, such as policymaking, research, and frontline management. I'm proud to introduce you with staff of our school. They contribute to COVID-19 responses in various ways, including supporting evidence-based policymaking, conducting relevant research to inform clinical and public health interventions, and delivering health education at media platforms. For instance, at the vital moment of fighting against COVID-19 in Wuhan, Dr. Zhi Guozhang served as a consultant for the National Health Commission. He used his statistical expertise to support decision-making regarding assignment of medical aid teams and technical supplies. Invited by the Standing Committee of Wuhan People's Congress, Professor Chen Chunfeng delivered a lecture on the further refinement of the public health emergency response system after containing the outbreak in Wuhan, which may facilitate further development of the public health system in China. As some of you may know that we obtained a lot of valuable experience regarding clinical treatment and health management in fighting against COVID-19 in Wuhan, Dr. Zhi Guozhang explored the potentially detrimental effect of COVID-19 on the vital organs, such as kidney and lung. The findings were published in top journals and provided some implications for future clinical interventions. During the epidemic, the school has hosted an international conference where Professor Hong Bingtao shared Wuhan's experience with domestic and international scholars, which may inform effective containment of the spread of virus. Scholars such as Professor Chen Chunfeng and Professor Heng Wu shared their perspectives on community mobilization in TV interviews, which helped to improve residents' understanding of how to protect themselves and others during the epidemic. On the other hand, as one of the top universities in training health management talent, the school has offered high-quality courses on research methods, research policy, health policy design and analysis in the past 40 years. This equipped the students with solid foundation of evidence-based policymaking. The alumni have done excellent work during the epidemic. For instance, Mr. Bingbing To from Tongji Hospital affiliated to Watchong University of Science and Technology assisted to the information system construction of the Hoshanshan Hospital at first outbreak. Mr. Guo Huayan from National Administration of Traditional Chinese Medicine received the personal award for his outstanding work in COVID-19 responses. Ms. Yu Hongzhu and Ms. Gai Yang received the award on behalf of the organizations they were affiliated to due to their outstanding work in fighting against COVID-19. The school not only cultivates domestic talent, it also provides international education to contribute to global health administration. The school has trained 30 international students from 18 countries of 3 continents, including Bangladesh, Thailand, Ethiopia, and the US, etc. The students received lectures as well as practice trainings in the fields of public health, hospital management, and health policy, etc. We are pleased to hear that these skills have helped them in pursuing their future career. Now, let's check out what they say about the school. Just give me one moment. I will
Okay, sure.
turn in a video.
My name is Dr. Tagani Rakasa. My Chinese name is Li Gang, Ni Hao, or Jiao Li Gang. I graduated from Tongji Medical College of Huazhong University of Science and Technology in Social Medicine and Health Management in the year 2018. I believe that School of Medicine and Health Management of Tongji Medical College is not only the right place for quality education, but also the center of excellence for research. Right after my graduation, I came back to Ethiopia and promoted to the Director of Public Relations and Communication of Ministry of Health. The knowledge I have acquired during my PhD study at Tongji Medical College, School of Medicine and Health Management helped me a lot, particularly on my position and the work I am responsible for in general. Currently, I am responsible for leading health communication of the country. As I am a management committee member of the ministry, I am responsible for decision maker and leading health communication of the country. Since we declared the first COVID-19 case on November 13, 2020, I have been mainly engaging in the prevention and control activities of coronavirus. I am leading COVID-19 National Communication and Media Task Force. In addition to providing credible and up-to-date information, we developed strategies, guidelines, and protocols and distributed to all concerned bodies in the country. The top management also assigned me in the COVID-19 research team based on my performance and published papers. I would like to thank my professors and teachers of Tongji Medical College, School of Medicine and Health Management, who had a great contribution to all these achievements and successes. Thank you.
And there is another one. Sorry. Sorry, one moment, I cannot find.
Okay.
Sorry for the interruption. I need to open another video. Yes. Here we
Yeah, it's okay. Don't worry. Take your time.
Can you hear? Can you see it now?
Nope, not currently. Yeah, I think you need to share your screen first.
Yeah. Can you see now?
Yes. Now we can.
Okay.
Yep.
Hi, my name is Dr. Bishwajit Ghosh. I'm a postdoctoral researcher at the School of Nursing in University of Ottawa, Canada. I have been working in this position since 2017. So it's been 3 years as a researcher here in Canada. Before coming here, I did my PhD in the School of Social Medicine and Health Management of Tongji Medical College in Wuhan. I was there for 3 years, from 2014 to 2017. And before that, I also did my master's in the School of Public Health, also in Tongji Medical College, from 2011 to 2014. So altogether, I spent about 6 years in Tongji Medical College. So that was great fun and plenty of experiences. I made many good friends who I still miss and who still misses me. I miss my professors and the beautiful campus. Of course, miss the great food of Wuhan. Well, even though I left Tongji Medical College, I still kept contact with my friends there, my colleagues there. I think the person for whom I'm making this video is also a colleague of mine. I'm constantly trying to come back to my mother university. I really want to work there as a researcher or maybe as a lecturer at some point. Yeah, so I think all I have to say about this college is that it's a beautiful experience to be there. The faculty, professors, research assistants, all other staffs, and the campus and friends. This is just a perfect place to be. I do not know much about how things work in other universities outside Hubei, but I have very good experience in the School of Social Medicine. So with that, I would like to give my full recommendation to this PhD course in this department. And for young researchers, I would say that this place has much to offer, more than you can imagine. So try to integrate yourself, especially for foreign students. Try to integrate yourself well with the local students, Chinese students, and the professors to reap most of the benefit. And if you can do that, a great future lies ahead of you. As I said before, this place has much more to offer than you can imagine. So with that, I would like to conclude this video. I wish you all best of luck with your career, with your whatever you are doing at Tongji Medical College, your master's or PhD or whatever. Enjoy the time there. Enjoy the friends and the foods. Bye.
Okay. And I think it's time to conclude. I'd like to go to, in the end, you are more than welcome to visit our official website or scan the below QR code to find out more about school. We sincerely invite you to apply for programs hosted by the school, join the Global Health Administration field with us, and contribute to the achievement of the Health for All goal. We look forward to meeting you at the School of Medicine and Health Management. That is all for my presentation. Thank you very much for your attention.
Thank you, Dr. Wang. That was very detailed, and I believe a lot of us are already excited to join the program. Okay, so next, please welcome Mr. Yu from the admission office to introduce the procedure of applying to study in China. and the admission policy, the scholarship-related information of Watchong University of Science and Technology. So please welcome Mr. Yu. Mr. Yu, please, you need to unmute your microphone first.
Okay. Sorry. Thank you, Mike. Now I will give you a PowerPoint to show a brief introduction of the admission and the policy of CSC. Okay, so first, this is the application guide for 2021 autumn intake. The link you can type it and to visit our application guide. And I've listed some information that you may mostly concern. First, eligibility and requirements for the applicants. When you apply for undergraduate program, you must have senior high school diploma, and for master, you must have bachelor degree. And for doctoral programs, you must have a master's degree. And please be patient. Please notice, you must have 3 out of 4 GPA or above to apply these programs. And for the language, if you choose a Chinese language, you must have a HSK4 for programs of science, engineering, and medicine. And you must have a HSK5 for economics, management, literature, education, philosophy, arts, and law. However, if your previous degree was instructed in Chinese, that means if you have a previous degree in China mainland or other related Chinese school, you can apply without the HSK certificate. Okay, and for English program, you must have a TOEFL, IELTS, or GRE, or other certificates of the same proficiency level which are accepted by our university. And also, if your previous degree was instructed in English, you can without this English certificate. Okay, and the documents needed for application. For all the programs, a passport and academic certificate is needed. And the transcript needed for all the academic program. And also the physical examination form, the certificate of non-criminal record, and the financial certificate. And for undergraduate and graduate programs, you need to also attach a personal statement that briefly introduce who you are, why you choose to study in China, and what are the main goals you choose this program. Also, you need the study plan and the language proficiency certificate. If you choose to apply for graduate programs, you also need a personal CV and 2 recommendation letters from the professors or teachers that taught you the previous academic program. And if you are from the partner universities, you can attach the nomination letter, and that will register you under the MOU between the universities. Okay. And now goes to the application procedures. Step 1, log in the online application system at the admission.hast.edu.cn. Be careful. This application system can only be used on the computer, and the recommended web browser is Google Chrome or Microsoft Edge. For now, it cannot be used on the mobile phone or other source of portal. Okay. And step 2, choose the program, upload the required documents that I just mentioned, and complete your application and submit. Step 3, finish the payment of application fee in due time. The application fee is 600 CN yuan or $100. However, if you come from the partner universities, you are free to pay this fee. And pay attention for this year's application. Upon receive payment, the application will be reviewed. And then if you are qualified, you will receive an email and be guided to an online test. This online test only come when you apply for the academic program. And if you choose to apply for the Chinese language program or the postgraduate program, you only test the language proficiency. That means you only test for Chinese language. And there are comprehensive tests for undergraduate applicants and for only the English taught program. Okay, and this test is, I think it's very easy for you. And this 4 step is for the application, and for admission, we have to evaluate by the school department. And for the postgraduate programs and also apply for CSE, the university will select candidates among the applicants and nominate them to the relevant authority. And when the authority gives us the result, the university will issue the admission notice and the visa application form to the winner and also self-support students. And about the tuition fee, you can see on this picture, for undergraduate program, it's among 18,000 to 25,000. And for medicine, it's more expensive than the other program. And the things you should notice is that the 5 English taught bachelor degree program, it has different tuition fee standard. Okay, and we provide the video when you need to apply online. You can watch this full video first, and I also listed the website URL for you. And someone want to know, I am interested in some major. Is that how to provide this program? You can also visit the program to see. For example, like the School of Mathematics and Statistics, they provide mathematics and statistics in both master and doctor, but only in Chinese language, you can see here. However, in School of Physics, their master's programs only taught in Chinese, but their doctoral program taught in both Chinese and English. Okay, now the most, I think you are most concerned about this, the CSE application. You can visit these 2 URL. The first one is the main CSE page, and the second one is I think it's called Category B CSE application, and that is the mostly applicants apply for to our university. I will explain to you the Category A and the Category B, the difference between them. The Category A means you apply from your own country through the dispatching authority. So you need to ask the dispatching authority in your country. And the Category B you apply the CSC through our university, through Watchong University of Science and Technology. Okay, that's the difference. And if you apply for the category B, you can look the details down this. Okay, first, this scholarship only supports graduate students. It means the applicants who apply for the master and the doctoral programs can apply this scholarship. Okay, and the time for master, no more than 3 years, academic years. For doctor, no more than 4 academic years. Okay, and the scholarship also covers the major study and the Chinese language study. And the language, both program taught in Chinese or English is available. And it covers the tuition fee, accommodation, stipend, and comprehensive medical insurance. It means if you win this scholarship, it may cost you almost nothing to study in our university. And at the time, you can start to apply now, and it will end in April the 15th. Okay, the procedure of this application: first, apply directly to our university. Step 2, complete the online application procedure at CGS Information Management System. I should warn you that this step 1 and step 2, you must to apply at the same time, because if you apply for our university through the online application system, you need to upload the CSC application form. And be careful, the scholarship program category is E, and our agency number is 10487. Okay, and then submit all your application documents to our university before the deadline, and then you should wait a candidate list and the winner list. Okay, at last, this is our QR code and our contact information. However, we are going to have a spring break for about 1.5 months. So I think the telephone and the fax is not respond at that time. You can contact us by the email. Okay.
Okay.
Okay, that's all the information.
Okay, thank you, Mr. Yu. And also thank you, Dr. Li, Dr. Wu, and Dr. Wang. We know a lot about the importance of health management during the COVID-19, and also we know a lot about the procedure of applying to study at UST. During our speech, we have a list of questions right here. Our staff members just collected from tons of questions in the chat box. So I'm just going to randomly pick some of them and ask the professionals here. So the first question is actually regarding the COVID-19, as everyone is so concerned about. So the first question is, what is the influence of COVID-19 on the development of China's economy? And furthermore, the world economy? How is the COVID-19 affecting the economy of China and the world?
If I may, so I think this question is much above my pay rate, and it's a huge question, and I think the President of China and President of the United States would like to answer it, and they can answer it in a very accurate way, but I'm not an economist, and my major is far away from the macroeconomics, but I can answer it, I think, a little bit from the health financing and also the United Health coverage. because this coronavirus, this COVID-19 from last year till now, of course, it caused a huge effect to China's economy and also the world's economy, and we can feel or we can see it from every way of the global media. But I think the most importantly is as the researcher or the scholar from healthcare management area, and how could we see these COVID-19? I think this coronavirus infected in a very severe way to the healthcare area, that is universal health coverage. During this pandemic, I think a lot of groups, especially the groups of the aging people, the vulnerable groups, such as the people in the poverty and the highly affected by this COVID-19. And in China, the government from the first day, they have been preparing how to respond to this outcome of the COVID-19 to the these groups of people in a financial way. So the government from the beginning, they started to make a lot of changes on the healthcare insurance in China and try to compensate the people who have the health insurance and how to manage these insurance to cover the cost of the COVID-19 treatment. Our university located in Wuhan, and I heard from my friends and also my colleagues that from the beginning, the government announced that this treatment, expenses of the treatment and prevention of the COVID-19 will be covered by the government. So these people these people have been covered by the public funding and full response to it, and also to the society. Government started to boost the economy from the very bottom level, and especially to these people who have small business. And the government started from the beginning that to compensate those people, those small businessmen, and to continue their business, and to at the same time of the lockdown in the city or the restriction of the mobility of the people. So I think I cannot say anything for the world to represent the world. So I think in China, the government and also the society have been done a lot to respond to this COVID-19 pandemic. So I hope I could answer partly of your question. And I think if you have more questions regarding on economy in China or economy in the world, and please send an email to us. And I think I can ask the professors in economy department in our university, and we have really good experts in our university in economy. So I think they could give you a better answer than me. Thank you so much.
Thank you, Dr. Lee. Yeah, I think we all know this question is like so big. It's not a question that can be answered like within a few minutes. I think we actually need an essay for it. Okay, so the second question is actually regarding the COVID-19 vaccine, which I think is like the hottest topic of the world right now. So the question is the COVID-19 vaccine capable of handling the mutation of COVID-19? And we are currently experiencing the second wave of COVID-19, and how will it affect our international students who are planning to study in China? So yeah, it's about the mutation of COVID-19. Okay. Yeah.
Yeah. So I think I could try to answer the first question, and the second question, I think maybe I could hand it to my colleague. And the first question, I think because I have been working in WHO in the past year, and for the WIPRO, the Western Pacific Regional Office, for the whole year last year. and I'm still the part-time consultant for that organization till now. And so I know a little bit information about things. Of course, as everybody knows that there are different vaccines now. They are producing or they are in trials, clinical trials in the world. I think your question is the COVID-19 vaccine capable to handling the COVID-19 virus? And I think scientifically, we already have seen a lot of evidence that those vaccines either produced by United States or the Oxford from United Kingdom, or the AstraZeneca or the from the German pharmaceutical company, and they have showed that the vaccines now is effectively prevents the virus from the people. So I think, and now also in China we have the different vaccines for the emergency use or in the clinical trial phase 3. So I have really huge confidence for those vaccines. And also in WHO, there are a lot of colleagues there, and they now collaborated with different governments, and they are trying to mobilize those vaccines from the pharmaceutical company to the community, from the development countries to developing countries or the underdeveloped countries. So also from the my colleagues in WHO, they also believe that those vaccines could handle the virus. So the answer, I think, is a positive. Of course, the positive, this word is not very positive words now. Okay, so I think the answer is positive. The vaccines could handle the COVID-19 pandemic in the future, but we need to wait, and we need to mobilize our resources in our country, in our own country, and also in the world via those international organizations. But the most important thing is we should keep confidence for those vaccines. We should have the confidence. Thank you so much. I hope I answered this question. Yeah.
Okay, so I think I can ask the half of this question, the back half. Okay, how will it affect our international students? Okay, I think the answer is separate from. Can you hear me now?
Yes, now we can. Now we can.
I can answer the question. How will it affect our international students? Okay, I think the answer is separate from the international students who are already in China now, and they who are outside the China mainland. For students in China mainland now, there are a lot of them are already applied for our university right now. I can feel their confidence. They feel safe, and they are eager to have higher education after their graduation, already study in China. However, for international students who are now outside China, they are concerned about several questions. Whether they can come to China this fall semester, in this September, and how isolation or other regulation about international students come to China. And they are also concerned about the flight, when they can get the ticket or not. So I think this really affects our admission work. And I think as the facts now, we can see we are still planning for the fall semester. It means the study starts in this September. The students who are outside the China mainland now may still have the online learning. Yes. when they want to apply and when they ask us, we always give this answer to them. You have to consider this situation that in this September, you cannot come to China, you cannot come into the campus, you have to study online. Okay.
Okay, thank you, Mr. Yu, and thank you, Dr. Li. Okay, now we have 2 more questions, and these 2 questions are asked to present in Chinese. So I'm going to ask our professionals in Chinese, and please answer the question in Chinese as well. OK， 这个问题呢是用中文问的。那这位学生呢是来自越南的梁美欣同学。那他问的这个问题是：请问贵校什么时候开始申请奖学金？哪一个专业是贵校的优势专业？
好，那这个问题的话，奖学金的申请现在已经开始了，就是我刚刚提到的，1月份开始，4月15日结束。然后，如果你是想要申请本科的奖学金呢，那么请问你们自己国家的派出机构，因为华中科技大学目前本科的奖学金仅有 A 类的 CAC 奖学金，然后如果你申请的是研究生，就是硕士和博士项目呢，那么 A 类奖学金和 B 类奖学金都是可以的，也就是说你可以通过你们自己国家的派出机构，或者是中国留学基金委来申请这个奖学金。然后至于我们学校的优质专业，这个要看，第一个是作为我们学校自身的优质专业，那么包括电信、计算机、临床医学等等。但是这些专业里面，请注意，仅有部分专业对于国际学生来说是他们的优势专业，因为像计算机是我们学校的王牌专业，但是它同时也被称之为，我们给他们一个外号叫做死亡专业。这个专业非常难以顺利毕业，所以我们一般会让国际学生申请的时候谨慎考虑像计算机、电信、机械及其自动化这种中文授课的专业，然后推荐他们尽量在本科的时候申请那5个英文授课的专业，也就是我们的药学、临床医学、国际经济与商务，然后电信学院的通信工程，以及机械学院的机械制造及其自动化，然后再像其他的我们学校的经济类的、管理类的，然后以及新闻类的都是优质专业，平时也是国际学生申请较多的专业。好的，
好的。谢谢于老师。那我们还有最后一个问题，也是用中文问的，也希望用中文回答。那这个问题是：请问贵校有新媒体和公共专业吗？这2个专业是否有提供奖学金？如果有的话，是哪一种奖学金呢？
新媒体和公关专业，好，那我需要现在帮你去查询一下那个青团他们的这个项目。我看他问到奖学金。那么他这个申请的是就是研究生项目吗？还是说是本科呢？如果是本科的话，是我刚刚提到的，它仅仅只有 A 类的奖学金，然后如果是研究生的话，就是 A、B 类都有。然后有关这个新媒体及公共专业，我们那个新闻与信息传播学院，它的研究生项目目前只对外招收新闻传播学，然后它的本科的话，有新闻学、广播电视学、广告学、传播学，然后播音与主持艺术，这5个都是用中文来教授的。现在有说新媒体与公关专业的话，我没有这样一个对应的专业。对应新媒体的话，那应该是我们的新媒体，应该是我们的新闻学或者广播电视学吧，我想。 公关专业的我们暂时没有。然后奖学金就是我刚刚提到的，
好的，谢谢于老师 ，Thank you, Mr. Yu. So, due to the time limit, this is all the questions we're gonna have tonight. If your questions hasn't been answered, you don't need to be disappointed. You can just refer to the group in Zalo or in WhatsApp, or just simply contact our staff members and they will provide assistance to you. Okay, thank you again. Thank you, Dr. Lee, Dr. Wang, Dr. Wu, and Mr. Yu. So that was very detailed and thoughtful, and I believe a lot of questions have been answered. Okay, so now we are coming down to the most exciting moment of the night, the lucky draw. So please, Chen Hui, please switch to the lucky draw screen. I know a lot of you have been waiting for this, and we're gonna start very soon. So if you haven't filled out the form before our lucky draw, you still have a few seconds. Okay, I think a lot of you have been familiar with this, so we're gonna start very soon. We're gonna start right now. Okay, let's see who is our first lucky audience. Gonna count down 3, 2, 1, go. And then stop. Okay, congratulations. Number ending with 87358. You are the first lucky guest of the night. You have won the full funded HSK training scholarship funded by Chinese Road. It's worth $200. You're very lucky. Congratulations. Okay, we're gonna have the second guest tonight, and I need to ask our professors, our doctors, to yell out start right now for our second guest. Okay, which is our professor to
so
okay.
Okay, so please start. Yep. Start.
Yep. And then
okay, everybody, stop.
Okay, congratulations. Number ending with 289855. You're the second lucky guest of the night. You have also won the HSK training scholarship worth of $200. Okay, so let's continue with our last lucky guy of the night. And should we have a lady to yell out the countdown?
Okay, can you hear me?
Yeah. Yes. Okay.
Shall we start?
Yep. 3, 2, 1, let's go.
Yeah, stop, please.
Stop. Okay. Number ended with 79082. You are the last lucky guy of the night. And congratulations, all the three of you. Please pay attention to our chat box. Our staff members will contact you and let you know all the procedure to accept the scholarship. So please pay attention to the chat box. We will inform you very soon. Okay, for those of you who haven't won a prize yet, you don't need to be disappointed because we are having a surprise event. If you'd like to improve your HSK scores or improve your possibility of getting a scholarship to study in China, please enter your country code and cell phone number in the chat box now. You will be able to participate in our HSK training classes with only 600 Chinese yuan. So hurry up and put in your cell phone number right now in the chat box. And we're gonna have 1 minute for all of you to fill out the numbers. Okay? OK， 如果我们还没有抽取到奖品的观众，也不要灰心哦。我们现在现场有一个神秘的彩蛋活动，就是如果你想要提高 HSK 成绩，或者说你想要提高申请来华留学奖学金的成功率，那么从现在开始，在聊天框输入区号和手机号就可以 用600元参加到我们的 HSK 特训班课程中。现在抓紧时间在屏幕上输入你的手机号码，我们只有1分钟的一个倒数时间。OK， 我相信刚刚已经过去了30秒。I believe we have only 30 seconds left for all of you to join our HSK training course with only 600 Chinese yuan. So yeah, simply like all of us are doing right now, we can see a lot of numbers in the chat box. Simply type in your country code plus your cell phone number, and then our staff member will contact you later. And they will explain to you and introduce our course and our services to you. So please hurry up. And then we're gonna have a countdown. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Stop. Okay. We're gonna stop right here. Our staff member will contact you with all of those who left the number in the chat box, and then please pay attention. Okay. So that's all for tonight. Okay, thank you all of you for all your participation. Our next event will be held January 21st, which is like 3 days later at 8 p.m. Beijing time. And then we will have Nanjing University with us, and we will be having the same experience. We have the same sharing, so please stay tuned. And last but not least, everybody, don't go. We're gonna have the last thing to do. We're gonna have the group selfie. So we're gonna have the group selfie, and before that, please take a look at the screen. We have a QR code for you to scan. So if you have any feedback or any suggestion, you can simply scan the QR code and tell us. Just let us know. Okay. So okay, turn on your camera. Are you ready? We're gonna have a group selfie, and all of you, we're gonna have a screenshot, and I'm gonna yell out 3, 2, 1 cheese later. So please be ready. Turn on your camera. Turn on your camera. Clean up your hair. If you need girl, if you need a lip gloss, you have 3 seconds. Okay, are you ready? Oh, I see a lot of you. Okay, 3, 2, 1, cheese. We're gonna have a group selfie. Okay, I think our staff members have collected our group selfie, and then we will post it later online. So please stay tuned. All right, that's all for tonight. Thank you for 1.5 hour participation. Thank you, Dr. Lee. Thank you, Dr. Wang. Thank you, Dr. Wu and Mr. Yu. You guys are very awesome tonight. Thank you so much. Thank you so much. And thank you all of you for all your time and all your patience. Thank you. Thank you. Thank you so much. We're going to see you next time.
Thank you, Michael. Thank you.
Thank you all.
Thank you all. Thank you.
Thank you, Dr. Wang. Thank you, Dr. Wu. Thank you, Mr. Yu. Okay. All right. See you next time.
Okay.